Hi, my name is Lisa Shiro. I am the owner of K Counseling and Anxiety Treatment here in beautiful Boise, Idaho. Thought I would just address what is EMDR. People are starting to talk about it a little bit more. People seek out therapists like myself just to get EMDR treatment. And in fact, what also sometimes happens is they'll be seeing another therapist, and the therapist will say, go see an EMDR therapist for this thing. So what is EMDR? EMDR stands for eye movement, desensitization, and reprocessing. Kind of a really fancy phrase for calming down the zing to the reaction we get with triggers. Makes sense, right? I mean, we know what triggers are. So triggers are sometimes those things that happen that or we see or touch or think or hear or smell that remind us and trigger an area in our body that makes us maybe panic or get scared. You know, your stomach twists up, your heart starts racing. You get what I'm saying. So EMDR is a great technique for calming down the response to triggers. So how does it work? So I actually am going to show you the machine today to show you what in the world this thing is. So it is what I use in therapy for many of the patients that I see who are suffering from past trauma, or if they have a phobia, that I will use this. We use it for social phobia. I use it for sometimes generalized anxiety disorder, sometimes depression symptoms. It just depends on the situation. But it is the #1 treatment for trauma. And so I thought I would just kind of pick it up over here and show you what it looks like. I'm actually in my office at the moment, but here is what that machine looks like. It looks like this. And so what we have here is a light bar. That's what you're looking at. It also comes, you'll put earphones on, and then these are little tappers that you hold in your hand. The reason one of them has a blue square is because we want to make sure that you're holding it with your right hand. And so you'll see there's a blue dot on the audio, the earphones too, indicating that I want you to use your right hand. And then there's a light bar here that sometimes I'll have you watch going back and forth. I'm going to set this back down again. And so in my office, that's what I will use to treat particularly anything that's trauma-based, and a lot of things are trauma-based. When things happen to a person, whether it's childhood or adulthood, when something happens and the brain doesn't know where to file it or what to do with it, it throws it back in the region of our brain that is referred to as the limbic region. It's kind of limbic region. It's like where the emotions are housed, so to speak. If you've heard terms like amygdala or fight, flight, or freeze response, these are where these kind of responses are typically triggered in that limbic system of your brain. And it's located on the right side of your brain, kind of toward the back, kind of close to the ear, right back in there. So this is a particularly effective treatment for anything that's trauma-based. And as I mentioned before, many things are trauma-based. And it is a treatment that is widely accepted by every major insurance provider that I work with. And I personally accept 3 different insurances: Blue Cross Blue Shield, Regents Blue Shield, and Blue Cross of Idaho. Big insurance providers, and they all are thumbs up on EMDR. It's an extremely effective treatment. Not only is it fast, it's permanent. What does that mean, Lisa, when you say it's permanent? Because I've been in counseling a long time. So what I mean to say is when it's permanent is if we're able to go into the situation and calm down the response to the trigger in my office over and over and over until it's reprocessed to the front of your thinking brain, the frontal part of your neocortex, the prefrontal cortex, like that thinking brain, it becomes more of a memory, not a leveling trigger. So permanency, well, that means that when you leave my office and we have kind of gone and cleared out that channel of whatever it is, maybe it's physical violence as an example. If once we've cleared out that channel and all associated issues with it, the way I know that it's cleared is because I can bring it up in session under a light trance and your body doesn't respond, because you see your body keeps score. So getting back to permanency, when you leave my office and go out into what is the real world, I mean, this isn't the real world in here, right? There's no triggers. But when you leave my office and go out into the real world, that same thing that used to trigger you and cause a reaction in your body will no longer cause a reaction. Well, Lisa, what are you doing? Are you erasing my memory? Absolutely not. That would be dangerous. What's happening is your brain has now processed it as a memory. It's simply a memory. It's calmed down the bodily responses. Doesn't that sound good? Listen, EMDR works incredibly well. And I like science. I like to be able to see the PET scans of a brain before EMDR. And then, 8 to 10, 12, 15 sessions of EMDR. And then we take a picture of the brain after that. What we've seen is that it doesn't light up that fight, flight, or freeze response area anymore. What does that mean? It's now in more of the logical area of the brain, the neocortex, the prefrontal cortex, where it's now filed as a memory. And friends, a lot of trauma is processed just fine. It's not like we have to go back and process every little thing, like who could remember that, right? But if you're somebody who has had a specific trauma, let's say it is a car accident, and every single time you come to that intersection, your body tightens up and your heart starts racing and you get scared, we need to process that. And if it's not with me, get it processed with an EMDR therapist somewhere. And there are many of them in the Valley. And one way you can find those is just go to Psychology Today and type, put your parameters in and specifically put in the letters EMDR. There are a few of these types of therapists in Treasure Valley that are trained to do this. It works remarkably fast. And so it really gets underneath the bodily sensations, calms it down. It doesn't just treat the symptoms, it just calms down where the source is. And then I tell people, pay attention. You are the expert on how you feel. So I often will tell people this after we've done several EMDR sessions, like pay attention. Pay attention. When you drive through that intersection, are you still feeling those feelings? And 9 times out of 10, they're just not anymore. So it's wildly effective. It's short in duration, no drugs involved, and is permanent. So I hope this was helpful to you today. If you found it helpful, please share it with people that really need to hear this message. Be sure and hit the bell and subscribe to this channel so you get more good, juicy, golden nuggets on anxiety issues, trauma issues, and as always, I invite you to comment on this link. Thank you so much. I hope you have a wonderful rest of your day.